Good morning. My name is Gonzalo Coronado from the Monterey County Health Department. I want to welcome all our friends and colleagues and partners. I just want to start off with introduction. I'm going to just introduce our Mistress of Ceremonies, but I wanted to, first of all, thank my colleagues from San Benito and Santa Cruz County. Been working together with them for years now, almost 10 years, and I just want to emphasize the value of inter-county collaboration. It's one of the highlights of my life, and it makes our jobs much easier when we're sharing resources, sharing our knowledges, and our experiences. I think that's one of the strengths that we in public service can bring together when we share our all the resources and bring them together, especially when we have such a very similar geographic area and our residents know each other many times, or they moved around from the same Tri-County area. I do want to just give two particular thank yous. One is to Christy Mitchie, from our epidemiologist from the health department, who I feel really strongly helps me understand our data that was presented to us, and so I feel a big support there. And I also want to thank the lady that I'm going to introduce next, which will be Karen Smith, who will be your mistress of ceremony. Thank you very much.
I'd like to introduce Eric Laurenson. Okay. He is the Agricultural Commissioner for Monterey County, and this is, they graciously let us use their building, and a great space this is. But I'm going to turn it over to him for a welcome. Thank you.
Well, thanks, Karen. Thanks to the Health Department, our Director, Elsa Jimenez, and Dr. Moreno, and all that are here from our Health Department, along with our neighboring counties, in releasing these important findings. I think it's real fitting that this event is here in our Ag Center conference room. It's really significant because our largest economic driver is agriculture, and a big part of our community is directly involved in agriculture or tied to the agricultural industry. Our office dedicates an incredible amount of time and energy to promote health and safety, especially in the field, with the farm worker community, especially around pesticide use. And we've been discussing recently, in addition to that, issues around food insecurity, nutrition, utilizing our Farm Worker Advisory Committee. And we support the notion of promoting health and safety to our farm worker community, and I think we believe the investment in that community is really reflective of an investment in our broader community. With ag representing over $4 billion here in Monterey County alone, and add Santa Cruz and San Benito, I think we're really well known for promoting healthy lifestyles through the production of fresh fruits and vegetables that are healthy to eat. Yet we have challenges, and I think I must applaud the health departments for bringing a group together like this to talk about the things that really need to be done to promote healthy choices. With that, I just want to welcome everybody here to the Ag Conference Center room and appreciate the invitation to participate. And as we work county to county, I think it's also important to work interdisciplinary within the county. So involving the Ag Commissioner's Office is good, and I know the Health Department works with social services and other agencies that are really committed to promoting health. And so I thank you so much for the opportunity to be here and welcome you, and I wish you a good panel discussion. So thanks very much.
Good morning. I'm Andreas Solano with the Santa Cruz County Health Services Agency. I'm a health educator, and I'm very happy to be here this morning together with Monterey and San Benito counties to share this important data with you all. Before I go, I'm going to provide a brief overview of why we're here today. Before I do that, I just want to let you know that I will be providing it first in English and then in Spanish. So thank you in advance for your patience while I do that. So we're here today because we know that stores play a critical role in the community's health through the items that they sell and market. Stores are not just businesses, but they're part of the everyday fabric of our neighborhoods. Children walk by them on their way to school, adults run in to buy a gallon of milk or a newspaper, and when they do, what do they see? Is there a selection of healthy foods such as fruit and vegetables, or are they inundated with items such as alcohol, tobacco, and sugary drinks? We know that many of these products contribute to lifelong chronic health issues such as diabetes, obesity, heart disease, and cancer. Healthy Stores for a Healthy Community is a statewide collaboration between tobacco, alcohol, nutrition, and STD prevention partners to collect information about the availability and marketing of healthy and unhealthy products in our stores. In 2013 and again in the summer of 2016, we surveyed over 7,000 stores that sell tobacco across California and gathered information about alcohol, tobacco, nutrition, and in 2016 about the availability of condoms. So today we're going to share some of the highlights of that data with you. Our goal is to educate consumers and retailers about how in-store product placements and marketing influence the consumption of unhealthy products. Ultimately, we strive to improve the health of Californians through changes in the retail environment. Working together, we can make the healthy choice the easy choice for consumers and maintain a vibrant business community. And now I'm happy to introduce Jason Hoppen, the Communications Manager for Santa Cruz County. But before he comes up, I'll just go right into the Spanish. So, buenos días, mi nombre es Andreas Solano, soy educadora de salud para el Condado de Santa Cruz. Estamos felices de colaborar con los condados de Monterrey y San Benito para compartir esta información con ustedes. Estamos aquí porque sabemos que las tiendas desempeñan un papel clave en la salud de la comunidad, a través de los productos que venden y promocionan. Las tiendas no solamente son negocios, también forman parte de la estructura diaria de nuestras vecindades. Los niños pasan por ellas en camino a la escuela, los adultos entran para comprar leche o un periódico, y cuando lo hacen, ¿qué ven? Ven productos saludables, así como frutas y verduras, o están enfrentados con cantidades de bebidas alcohólicas, productos de tabaco o bebidas azucaradas. Sabemos que todas estas provocan enfermedades crónicas, tales como la obesidad, la diabetes, enfermedades cardíacas y el cáncer. Tiendas saludables para una comunidad saludable es una campaña a nivel estatal formada por colaboradores dedicados a la prevención del consumo del tabaco, el consumo de alcohol, prevención de enfermedades de transmisión sexual y nutrición, que trabajan para recopilar información sobre la venta y la disponibilidad de alimentos saludables y esos que no se consideran saludables en las tiendas. En el 2013 y otra vez en el 2016 hicimos una encuesta en más de 7,000 tiendas en todo el estado de California y se recopiló información sobre los productos de tabaco, bebidas alcohólicas, opciones alimenticias y en el 2016 la disponibilidad de condones. Hoy quisiéramos compartir los hallazgos más notables de esa encuesta con ustedes. Nuestra meta principal es educar a la comunidad sobre la venta y la disponibilidad de ciertos productos y cómo esos productos afectan al consumidor. Al final, estamos trabajando para mejorar a la salud a través de cambios en las tiendas. Trabajando juntos podemos hacer que la opción saludable sea la opción fácil para el consumidor y al mismo tiempo mantener un negocio exitoso. Y ahora les presento a Jason Hoppen, gerente de comunicaciones del Condado de Santa Cruz. Gracias.
Thank you, Andrea, and thank you all for joining us today. Now that you understand the background and purpose of the Healthy Stores for Healthy Community survey, I'm going to share some of the survey results for Santa Cruz County. But first, a little test. In one hand, I'm holding a package of candy. In the other, a Swisher Sweet, a popular brand of little cigar widely available in local stores. Can you tell the difference? Both have colorful packaging, fun names, and come in fruity flavors. It's tough to tell the difference, isn't it? Why does this matter? It matters because according to the HSHC data, 60% of the stores near schools in Santa Cruz County sell flavored tobacco products, including these little cigars, often for less than $1. These are 2 for 99 cents. So for the cost of a candy bar, students can buy one of these little cigars, and we're not alone. Statewide, 4 out of 5 stores sell flavored tobacco products such as Cherry Crush e-cigarettes, Gummy Bear e-juice, or Pineapple Express cigarillos. That's right, Gummy Bear. The data also shows that between 2013 and 2016, the percentage of stores selling e-cigarettes in Santa Cruz County increased by 67%, from just over a third to 57% now. E-cigarettes are now the most commonly used tobacco product for teens, and just like other flavored tobacco products, e-cigs are clearly meant to appeal to youth with e-liquid flavors such as grape, watermelon, and chocolate. Research confirms that teens who use e-cigs are 3 times more likely to smoke traditional cigarettes 1 year later. It's a starter product for a lifelong addiction to nicotine. The data also shows that Santa Cruz County kids are bombarded with alcohol and tobacco advertising versus ads for healthy items, such as fruits and vegetables. 67% of stores near schools have unhealthy storefront ads. Our school zones should be safe, healthy places to learn and grow, not locations for alcohol and tobacco companies to prey on those least prepared to resist their marketing tactics. In Santa Cruz County, we are working to decrease youth access to e-cigarettes and other flavored tobacco products through tobacco retail licenses and distance ordinances from schools and other youth-serving organizations. We are also working directly with youth to educate them about the dangers of emerging tobacco products targeted to youth. And now I'm happy to introduce Gina Cole, the chair of the Santa Cruz County Tobacco Education Coalition, who's going to talk about flavored alcohol products. Gina.
Good morning. My name is Gina Cole, and I am the Senior Policy Analyst for Pajaro Valley Prevention and Student Assistance, a small nonprofit over in Watsonville, and I'm the chair of the Santa Cruz County Tobacco Education Coalition. I'm glad to be following Jason this morning because much of what he just said about flavored tobacco products is the same information for flavored alcohol products. According to the Healthy Stores for Healthy Communities data, 80% of the stores in Santa Cruz County sell alcohol. And of those stores, 26% sell Alcopops. For those of you who don't know, Alcopops are sweetened alcoholic drinks that taste closer to soda pop than beer, thus the name Alcopop. These include brands like Four Loko and Smirnoff Ice, and other brands like Mike's Hard Lemonade, Angry Orchard, Hard Cider, and Not Your Father's Root Beer. A 23.5-ounce can of Four Loko may contain an alcohol content by volume of either 8%, 12%, or even 14%. A 12% can has the equivalent of 4.5 shots of vodka. So that's 4 servings of alcohol in one 23.5-ounce can. They cost about $3. You can see how appealing that might be to youth. They're also available in about 12 different flavors, ranging from watermelon to sour apple. So just like those flavored tobacco products that Jason talked about, flavored alcohol products come in bright packaging, very, very colorful. They're very similar to a can, say, of the Arizona iced tea. They're about the same size and they're about the same pretty colors. They are an initiation product, and that should concern us. Youth consumers who are new to alcohol prefer that sweet taste, and that leads them down to the next level. To make matters worse, the stores that sell alcohol in Santa Cruz County, 17% have alcohol ads that are near candy aisles, that are near toys, or that are about 3 feet high. All of that where children can view them. As a parent of 3 youth, I have a 20-year-old, a 14-year-old, and an 11-year-old, I try to be up on what's going on, and I charge you all to take a field trip to a local store. Go see what's in that store. Look at the tobacco products that are being sold. Look at the alcohol products that are being sold. See what might appeal to your child. And don't be afraid to mention to the girl behind the counter, hey, why are you selling this? Or hey, maybe you should consider putting this on a top shelf instead of putting it on a lower shelf. I encourage you all to do that, not just for your own kids, but for our communities. So as parents and as community members, we need to be up on what's going on. Thank you a bunch for your time today. I'm now going to pass over to Sam Perez from San Benito County.
Thank you, Gina. Good morning, and I just want to say thank you to everyone here today to make this a priority and supporting us in this effort. My name is Sam Perez, and I'm the Program Manager for Public Health Services in San Benito County. The retail environment is the tobacco industry's main point of entry into our local communities, where a bulk of the advertising and promotional budgets are spent. The Tri-County Region Healthy Stores, Healthy Community Survey found that 66% of the stores advertised unhealthy products in their storefronts, as Jason alluded to in his presentation. This survey found that storefronts were saturated with unhealthy storefront advertisements for tobacco, sugary drinks, especially in low-income and minority communities. Research shows that youth are highly influenced by marketing of products. We found that 3 out of 4 stores in our communities had unhealthy storefront advertisement. Marketing practices, even more than peer pressure, impact youth purchasing decisions. Purchase decisions and lifestyle choices that are established in youth can lay the foundation for good health in years to come, or can lead to obesity, chronic illness, and even death. We are aware of advertising placement is not just by circumstance. There's a lot of innovative thinking and money behind the placement of advertisements in stores. Retailers choosing to promote a certain item often receive money paid by the vendor or manufacturer. Many grocers earn more profit by agreeing to promote the product than actually selling the product. We have taken the initial steps in determining that there is an overwhelming amount of unhealthy advertisements in stores. Now it's time for us, along with you, along with our communities, to take action. And this action can be as simple as talking directly to retailers to suggest decreasing messaging, as Gina had mentioned, acknowledging retailers who have reduced the amount of unhealthy advertisement they have in stores, and are talking to local policymakers to establish and or enforce existing policies such as Lee Law. It is us to make the change in our communities. Again, thank you very much, and I'll turn it over to Erica Vain, who is the co-chair for Nutrition and Fitness Collaborative for the Central Coast. Thank you.
Thank you, Sam, and good morning, everyone. Thank you for being here. My name is Erica Vain, and I am a health education associate with the Nutrition Education and Obesity Prevention Program in San Benito County, and also the co-chair for the Nutrition and Fitness Collaborative of the Central Coast. We live in the salad bowl of the country, and just to make my point clear, if you drive up here to Highway 1 to Santa Cruz, then over to San Benito County, you will most likely pass over a dozen different field crops. One would think that purchasing these fruits and vegetables in this area specifically would be easy. Unfortunately, many residents who work with these crops have no access to them. The survey found that only 28% of stores in the Tri-County region sold fresh fruit and vegetables. We also found that, getting a bag of chips is so much cheaper than getting a box of berries, a small box of berries. So with limited access, these families our families in the communities are not getting the fruits and vegetables they need to fuel their bodies. While conducting the survey, we also found that in the Tri-County region, tobacco products are more accessible than milk and fruit. Less than half of the retailers surveyed sold low or non-fat milk. So I'm sad to say that number has only increased by 9% from the data from 3 years ago. When it comes to advertisements, 35% of all stores in the region had a sugary drink storefront advertising. So in addition, 29% of the stores in the region have sugary drinks near the checkout lane. So it's easy access. It's all about location. So with all this ads, on the outside, and then you have right at the very end of your trip to the store, those sugary drinks, it's no surprise that the average teen in California consumes 39 pounds of sugar a year from sugary drinks. It's not counting food, just from drinks. So as a result of the current concerns in our communities, we have the nutrition education and obesity prevention programs that we conduct, Harvest of the Month presentations, health eating, Rethink Your Drink presentations in local schools. So this opportunity serves to promote fruits and vegetables that are in season, that are grown in our communities, as well as promoting healthy behaviors to students, parents, and teachers. Recently, while conducting at a local lesson at a local school, we encountered a student that had never had carrots. And lastly, with the nutrition education program, we try to make that connection and help our low-income communities have access to foods by referring people to our local food banks and to the CalFresh program. So thank you for your time. Now I'm going to hand it over to Andrea Lopez of Monterey County.
Good morning. My name is Andrea Lopez. I am a co-chair of the Monterey County Collaborates. Monterey County Collaborates is a group of individuals and organizations advocating for a safe and healthy Monterey County. Our vision statement is a Monterey County where youth are safe and become leaders and facilitate healthy choices. Our mission statement is to support, educate, and empower youth and families to create safe and healthy environments. In 2013, as a member of the Sunrise House Prevention Youth Council, I participated in the Healthy Store and Healthy Community Survey, and I look forward to sharing the results with you. I would like to address 3 things from the survey that I feel are important, which are flavored tobacco products, product placement, and storefront advertising. The tobacco industry targets youth with flavored tobacco products. The percent of stores near schools with flavored non-cigarette tobacco products increased from 75% in 2013 to 79% in 2016. Another item that is concerning is the placement of alcohol and tobacco and unhealthy products at eye level for children. The percent of stores with tobacco marketing in kid-friendly locations was 28% in 2016. There is no need to advertise tobacco in child-friendly places. Regarding healthy and unhealthy storefront ads, the percent of stores near schools with unhealthy storefront ads was 79% in 2016, which was 7% higher than in 2013 and 8% higher than the statewide average. This compares to the percent of stores with healthy storefront ads, which decreased from 14% in 2013 to 4% in 2016. This is 10% less than the statewide average. Thank you, and it is now my pleasure to introduce our next speaker, Dr. Ed Moreno, Health Officer and Director of the Public Health Bureau for Monterey County.
All right, good morning, everyone. Thank you, Andrea. So, as we get towards the end of our presentation today, I've been asked to talk about one portion of the survey, and that is the portion that surveyed the availability of condoms in the stores that sell tobacco. As we've heard already, our community stores play an important role in helping youth and adults live healthier lives. In particular, our community stores can help youth and adults plan pregnancies and prevent sexually transmitted infections such as gonorrhea, chlamydia, and HIV. Stores that sell condoms improve community access to condoms, which can prevent teen pregnancy, unintended pregnancies, and again, prevent sexually transmitted diseases. A recent study in 2015 showed that suggests that communities that lack access to condoms are associated with increased rates of sexually transmitted infections, particularly gonorrhea and chlamydia. This survey shows that in Monterey County, 68% of the stores surveyed sold condoms, and we appreciate the stores that do sell condoms for making them available to our communities. However, when we compare our county to California, across California, 81% of stores surveyed made condoms available in their stores. So this suggests that Monterey County residents have less access to condoms compared to the rest of the state. We also know that individuals may feel uncomfortable or embarrassed in making purchasing condoms. And so minimizing barriers in the stores is important to help individuals make healthy choices. This survey shows that in Monterey County, about 26% of the stores that sold condoms placed the condoms on the shelves unlocked. So that we appreciate that. Those stores are making it easier for folks to get youth and adults to get condoms. However, this means that the remaining stores surveyed had them locked up or less accessible to the customers. A study in 2010, a report in 2010, suggested that barriers such as having to ask a clerk to unlock a cabinet or to access items behind the counter have demonstrated reduced condom access. Now, when we compare our county to California, we find that 37% of California stores that were in the survey stocked condoms on the shelves unlocked, which is a greater percentage than in Monterey County. So this suggests again that Monterey County residents have less access, easy access to condoms in stores compared to the rest of the state. Now, I mentioned that access to condoms reduces sexually transmitted infections. Sexually transmitted infections can affect anyone that's sexually active. However, we know that certain populations are affected by sexually transmitted infections than other populations. We know that youth ages 15 to 24 represent about 25% of the sexually active population in the U.S., but account for approximately 50% of new sexually transmitted infections each year. So we know that youth are more affected by sexually transmitted infections than other populations. We also know that African American and Hispanic residents of Monterey County are disproportionately affected by sexually transmitted infections and HIV. Now, there are several sexually transmitted infections that we track here in Monterey County. I'm just going to mention one this morning, and that is gonorrhea. In 2016, one in a little over 1,000 Monterey County residents was diagnosed with gonorrhea. And this represents a 10% increase in the rate of gonorrhea compared to 2015. But this rate has been increasing every year since 2011. If we compare last year to 2011, it's a 267% increase from 2011. In other words, another way of saying that is that the rate of gonorrhea in Monterey County has quadrupled since 2011. In response to the increased rates of gonorrhea in our county, our community should work to increase condom access throughout the county, not just in stores, but continue to support those youth-serving agencies that make condoms readily available to youth and to young adults. I do want to point out that access to condoms in stores is just one factor that impacts sexually transmitted infections. There's stigma related to getting condoms or other sources of pregnancy prevention or STI prevention, economic factors, and restricted access to health education and health services all contribute to disparities of sexually transmitted infections among youth and people of color. In conclusion, the stores that conveniently stock and promote items that encourage customers to make healthy choices like condoms are an integral part of improving the overall health of our community. And my hope is that as we move forward, we can work with store owners to make condoms more readily available and accessible in their stores. So I want to thank you and like to introduce Ernan Chavez, who's a student at San Benito High School in Hollister.
Hello, how's everybody doing today? Good? Okay. Well, I'm very happy and grateful to be here today, mostly because I'm not at school. And also because I think public speaking for young people is very hard, but any chance I get to do it, I take it. So, yeah. So my name is Ernan Chavez. I'm 17 years old. I'm a senior at San Benito High School, and I've been a member of the San Benito County Tobacco Youth Coalition since April, so almost about a year. And I appreciate the opportunity today to represent all of the youth from the Central Coast. We are all direct targets of the tobacco industry. Being a youth in this day and age is not easy. It's quite difficult, actually. We have to make many choices every day, and our lives can be very complicated with all the messages coming our way. Whether it's vaping a cotton candy tasting e-cigarette, drinking a lemonade flavored alcopop, or buying that high fat bag of chips, which is actually cheaper than a bag of grapes. The marketing world understands that we may be influenced easily because we are young and perhaps naive, but I'm here today to tell everybody, don't be fooled. We are catching on to their strategies to recruit new consumers of their unhealthy products. And me personally, I feel that the tobacco industry see me and my peers as just dollar signs. They advertise and put addictive chemicals in cigarettes to get us hooked at a young age. Before joining the San Bernardino County Tobacco Youth Coalition, I had no idea of all the ways that the tobacco industry's profit off of us. And the reason I joined the Tobacco Youth Coalition was to gain knowledge on how to combat these tobacco industries and help to create a healthier community. We as a society have our work cut out for us as we work against these. We as a society have our work cut out for us as we work against these messages. But we can and will make a difference today. I truly believe that it is the responsibility of all of us in this room to share the findings of the HSHC surveys. Get the word out there that the youth will not be part of the recruitment games of the tobacco industry. We have the knowledge, passion, and the ability to make this region a healthier place. And it starts today with each and every one of us. Thank you.
Thank you, Renando. Okay, so now it's time for questions. And I will take any from the audience. Anyone? Don't make me say it. Chris.
Okay. How do you fight back against the slotting fees that are paid to grocers if they're making more from that than the product that they're selling?
Who wants to take that one? Sam?
Okay.
Thank you, Chris, for your interest in slotting fees. I find this perplexing myself because, as I mentioned before, the retailers actually receive more money for placing an advertisement promoting this unhealthy product than they do for actually selling it. In some of our local communities, for instance, in San Bernardino County, we have a lot of mom and pop stores, and it's very difficult for us to go in there and tell them to decrease the amount of advertising, know that they are making profit off of it, that might be keeping their store open, for that matter. So I think that one of the things that we've done is to sort of like get the attention of their moral compass, if you will, and encourage them to reduce it as a good gesture, for that matter. Of course, we've used LELAW as an issue too in our communities. LELAW is the reduction of advertisement overall. The state law says that one cannot have over 33% of their storefront covered by advertisements, because that would prohibit, for instance, law enforcement from seeing in, or others from seeing in, if they had to come to an incident that's occurring in the store. Unfortunately, though, law enforcement isn't really enforcing this, if you will, in many communities in our counties. So again, just the encouragement to get out there and to promote good messaging, to seek out to raise the awareness that it's in the best interest of our communities to make our community nicer looking, more pleasant, to discourage unhealthy advertisement because it attracts youth and in a negative fashion, and just to persevere. I know that really doesn't get to the heart of it, but I think by us working with our local retailers in a united force and encouraging them is probably the best approach we can use. We're not their enemy, we're their partner. So, thank you.
Any other questions? Anne?
thank you. I'm wondering whether or not you saw a difference in placement and advertising when you looked at the different kinds of stores. You know, I'm finding that my drugstore is serving more food products. And so folks might run in, and so whether or not, I haven't even looked to see whether or not they have no fat milk in addition to whole fat milk. But because some of them are becoming almost a convenience store-like vendor for food products, did you see a difference in placement and advertising across the spectrum of big box stores all the way down to mom and pop stores?
Anybody want to take that?
I don't know if you cut and dice the data that way.
I don't know that the data was diced that way, but you can.
Try to answer that.
Yes.
And I have the advertisement here since I'm up here already. So, and that's a very good question, and the data is collected. As far as it was breaking it down for us, I'm sure we can ask the state or Stanford, whoever analyzed it, to see if they have it broken down as you described. I'm not sure, for some reason that has not been shared with us, at least at my understanding. Christy reviewed the survey methodology. I'm not sure if it was addressed there, but that's a good question. That's one we can follow up on. If I can also point out, as soon as you leave through this door, there's going to be this piece that has different policies that are really easily doable policies that can be done. And I'll just read just a couple of them. Prohibit tobacco from being sold near schools or tobaccos. Encourage WIC and SNAP. Limit the amount of all storefront advertising I was mentioned. Maintain clean and attractive premises. Prohibit tobacco discounts. So there's a lot more, so they'll be right outside, simple policies that can be implemented. Thank you.
Patricia?
Yeah, just a question, bigger picture policy question. Chris Moss and I often talk about liquor stores that are masquerading as mom and pop stores. So question for you all, what point does a mom and pop store really selling more liquor than anything else? And my thought on that is, if the population was more aware of all of these corner stores, a great big liquor sign on it, they may be more adverse to having that type of a store in the neighborhood than the ones that are pretending to sell food when actually they're making far more of their profits off of liquor, tobacco, and other products. You know, the funny thing is liquor stores can sell food, they can sell, you know, big potato chips and Slim Jims and that sort of thing. We don't call them a grocery store. But when mom and pop stores sell a lot of liquor, we still call them grocery stores.
Grocery stores.
Thanks for the question. I would just my thought is that one approach would be to target certain stores. Another approach would be to not target stores, but just take broad policy. And one policy, for example, would be to limit the concentration of liquor licenses to sell liquor in communities. And so it doesn't matter whether you're a Safeway or a small family-owned store. Once the community is saturated with stores that sell alcohol, there's no further licenses or permits provided in that community. Another approach would be a broad policy that creates a minimum distance between schools and places that have vulnerable populations like children and places that sell alcohol. So again, it doesn't matter what type of store we're talking about. They just can't sell alcohol within a certain distance of the schools.
Anyone else?
Hi, my name is Eduardo. I'm with the Monterey County Health Department. Gonzalo brought some really great points about policies that we can do to not really prevent the type of promotion of these type of dangerous materials. Is there some sort of policy or some sort of initiative taking place that can put these policies in effect?
Gonzalo, do you want to handle that one? Or Andrea?
I can. Well,
Yes.
I can say that in general, all of our counties are working on policies to either restrict the number of retailers or place distance requirements on retailers, and are working with retailers to promote healthy items and providing incentives for store owners and working with them on marketing of healthy items. I know through nutrition and SNAP Ed programs, that's something that they're doing, healthy corner store markets. And I think some of our organizations in Santa Cruz County are also working on limiting the number of alcohol retailers as well, in particular the ones that are close to either schools or youth serving agencies.
And I would just like to add one more thing to what you had mentioned, that I think the most important thing is there's a lot of policies out there, and we are unaware of all the policies that exist. Even some of the policymakers are unaware of some of the policies that exist. There's a lot of policies on the books, and I think things like today, for instance, us getting up here and raising the awareness that, hey, there are things like, there's policies like Lee Law that prohibit the amount of outdoor advertisement that a store can have, or other policies that are established at a local level. The more education that we do, the more education, the more that you as a media cover these stories and promote our policies, the more awareness it will be. Because like I said before, a lot of people aren't even aware that policies exist. So again, thank you very much for taking time to be here today to learn more about these very important policies, and hopefully you'll share them with your people in your community.
Thank you.
Anyone else? Dale?
Yes, thank you. I'm Dale Dillard. Can you tell me if the data is broken down by zip codes? And the reason I ask this is because when I've worked with elected officials, especially like on a city council that represent a certain zip code, when I can go to them and say, this is your sales rate, this is what's kind of going on in your community, it makes them aware that maybe they do have a problem, that, because we go to the grocery store, we just see the stuff, and we usually don't get involved at that level.
More of a, what about me?
But if the data is just by county, it's kind of like, well, it's not my neighborhood. But if it's broken down, and I don't know, that's why I'm asking the question, and if it's not broken down by zip code, hopefully in the future it may be, because, or by, other than just by city. I'm thinking about Salinas, where I've been trying to work on the TRL there, and some elected officials kind of like, well, it's not my neighborhood. And I'm not sure they're aware of how many tobacco retailers are in their neighborhood, which is broken down by zip code sometimes. Thank you.
Thank you for the question. That's similar to the answer that the question that Ann proposed. They were done by zip code. The data that's given back to us is not broken down by zip code, but we can ask whoever analyzed it to see if we can get that information. I think it would be good to know. Anecdotally, you can ask Rochelle, it's right next to you. He did a lot of these surveys as her part of her work with Sunrise House. Maybe you can tell us, I think we did a lot of it was in the city. I know we did Seaside, and I'm sure there was, I can't remember the zip codes exactly. Maybe you can remember.
It was 93905. We did South County, which was Bradley, San Lucas, and a couple of other ones down there. And we did Seaside.
So 93905, 93906, 93955, and others in South County that I don't have. I don't have the exact numbers, but that's a good question. We'll try to track down that information.
One more question, and since you're up there, how is this information going to be available? Website, and that. Do you understand?
Andreas, tell me. You can go ahead and answer that.
Unless you want me to, I can too.
Well, one thing is this is the beginning of it. And just as we were probably starting this morning, there was a website that was just released called Healthy Stores, Healthy Communities. As soon as we leave, we will try to have a screen up in the next room, and that has all the data for all the states, and comparing 2013 for the whole state, and 2016, and also for each county. So that's the one step. One of the things I wrote down for myself, one of the things we're going to do is send this information and maybe set up a meeting with the Ag Commissioner so he knows exactly, what are the things that we're measuring. This is just the beginning of the awareness, and now the hard part now is getting the community together and to continue to educate the folks about what's going on, the different examples. And then from there, the community itself will tell us what direction they want to do. Is it flavored tobacco product, flavored alcohol? Is it the Lee law, the advertising? Is it condoms, accessibility? There's so many different things that you saw, and it will be us communities getting together and deciding which ones we want to do with all of you in the audience. Okay. I don't know if anybody wants to add to that.
I think you did good.
And at 10:30, Monterey County released the press release that has the highlights of the survey. It's also available on our website, and we've been tweeting about it. So they'll social media, and like Gonzalo said, this is the beginning. So anything? I want to thank everybody for taking the time out to come in here and working together for our healthier communities. Thank you.